Hello everybody, this is Dr. G from Trusted Dental Care right here in Wiley, Texas. Okay, it's not far away from Dallas and the DFW area. Anyways, today I wanted to share with you a little bit of a tip on how we brush our teeth. Okay, a lot of people actually have no idea when they go to Walmart or Costco, whatever. How do you pick a good toothbrush? Okay, so I'm gonna walk you through. There are a few things you should consider when you're buying a new brush. Okay, so step one, if you can get electric brush, get electric brush. The reason is electric brush is a lot more efficient. It can remove plaque. It can get rid of bacteria a lot faster than you would with your manual hand. Okay, so there are a couple of brands I recommend. I personally use. One is Oral-B, and the second one is Sonicare. Those two, I mean, I've been using them for the last, 15-20 years, and they work really well. Obviously you can see the teeth. So I definitely recommend any one of those products. Okay, and the other thing is that they've got a software you can download, and they can walk you through your brushing techniques and all those things. I think, quite frankly, I've done that, and it's amazing like how much areas of our mouth I was missing before I actually watched those videos. But if you're getting a hand brush, then the number one criteria for a hand brush is going to be a soft or extra soft brush. Okay, so if you come to our office, we'll give you a sample. I do actually have this brush right here. It's fantastic. As you can see, it is extra soft. And so when I'm traveling, if I don't carry my electric brush, definitely this is what is in my bag. Okay, so I used it and I love it. It's very soft. It's very like extra soft. I mean, the bristles are amazing, and so it's easy to get rid of anything from your gum and all that. So the other thing I wanted to show you is that how do you actually brush? What's the technique? Okay, so most people do this or this, but there's an actual technique. It's called what is it called? The modified bass, whatever. I forgot about it. Okay, I just blocked out. Anyway, but it happens. I'm in the video. But the technique is really, when you're actually looking at it, you actually wanna put a 45-degree angle towards the gum line. Okay, so if you're doing the upper teeth, you're doing the angle 45 degree toward the gum line. If you're doing the lower teeth, you do this way, 45-degree angle. And what all of that is that when you're brushing, you point at the gum line and then you go in circles so that you can get, so you go circle. So you go all around each tooth, making sure you're brushing all the surface of each tooth. So you have to kind of move. And that's why I was saying that electric brush is a lot more efficient, because you don't have to worry about moving it with your hand, because it's got already built in. It's moving. And then you want to make sure that you do that with the inside of your mouth. All the surface has to be clean. Okay, so that's that. At the end, what I typically like to do would be and brush. Yes, of course, we have to brush and floss. And yes, the brushing will get rid of all the plaque around the tooth, and the floss will get rid of it anywhere in between teeth. And so again, the best technique to do would be you cut a piece of floss like this, you wrap it around your finger, both of them, and then you go in around this tooth and then adjacent the other tooth. So you go in one by one and floss. Okay, that's all that is. It's not that difficult. Takes 30 seconds. Just do it. Okay, it's cheaper that way than you don't floss it, then you get what we call flossing cavities in between your teeth. And guess what's gonna happen? You're gonna come, doctor is gonna go. It's gonna be expensive. You're gonna need a filling. You're gonna need this and that. So I would definitely recommend this preventatively. Okay. One last thing I wanted to talk about is the mouth rinses. There are quite a bit of mouth rinses in the market, but as you know, Dr. G likes to follow the recent recommendations, what's recommended, evidence-based dentistry. This is by our leading dental provider researcher, Dr. John Kois. He has a chart of what our mouth rinse should be. And so obviously you can see there is a red light right here. And that is neutral pH 7. And so what that is that corresponds with our natural pH of our mouth. Okay, so normally, let's say if I'm not eating, I'm not drinking, normally, when I have enough saliva flow, my anybody's mouth should be at a pH of 7. Okay, there are factors that actually change that. There's medications that can change it. There is frequency eating, there is sugar consumption, there's all kinds of stuff that actually can lower that pH. Okay, and so basically what happens is when that pH goes down, let's say if you're eating all day, or if you're bulimic, or if you are drinking energy drinks, soda, all those things will lower that pH from pH 7 to, in some situations, it can drop to 5 or 4, okay, depending on the consumption that you have. And a lot of the damage in the teeth happens at lower pH, you guys, okay? So if you're consuming a lot of sugar, a lot of soda, a lot of energy drinks, which means that your buffer, your mouth is at a very, very acidic condition, and there is a certain bacteria that thrive in that acidic pH that makes a lot of damage, that produces a lot of acid and toxic, in that cause gum disease and other factors. And the other thing is, when the pH is very, very acidic, you're literally soaking your teeth in an acid, which makes a lot of erosion. So your teeth just gets eroded and eroded and eroded. The enamel gets thinner and thinner and thinner, which can cause cavities just that quick, okay? So, before I get lost, this is a lot of information to swallow, but the whole idea would be, you brush, you floss, and then at the end you rinse with something very basic, which means that you want to neutralize your mouth to a higher pH, 7 or more. So the products that I'm going to recommend you would be, if you go into Walmart or Costco, whatever, you gotta make sure that the products you're gonna get has pH 7 or more. Okay, if you need a certain product name, brand, you may not find this in the market, but since we are dental providers, we can actually get products that you can buy. We have some products that we sell here in the office that actually is specific. If I have a patient who's on medications and whatnot, I typically would talk to them and say, okay, you know what, you're keeping that mouth very acidic, so we have to have a certain higher pH products. And that's it. I know I've talked a lot, there's a lot of information, but at the same time, I don't want to keep you longer. I'm trying to make this video as short as possible, but this is short for me, so I don't know, maybe 5 minutes, 10 minutes. Anyways, if you have questions, please feel free, come by, call our office, and I can walk you through this, and I can give you the actual very specific recommendations based on your dental needs. Comprende? Thank you.
Adios.